Hey there! In this short video, I'm going to talk to you a little bit about usage and safety guidelines for essential oils while you're pregnant. Of course, you want to be extra safe and careful while you're pregnant and using essential oils, but there are some guidelines that you can follow that help you figure it all out without being nervous or worrying that you're doing something that's unsafe. So the first thing I have to say is that I'm not a medical doctor, and so you should always try and find a trusted health practitioner to help you figure out what the best things are for you to do for your health while you're pregnant. That being said, you can also navigate the world of essential oils by yourself and with a little assistance and still make good choices. So the first thing that you should do is research. If you have the essential oils pocket reference or desk reference, always look up an oil or a condition there first and see what it tells you to do. See if there's any contraindications for pregnancy, and then go from there. I like to do a lot of my searching on the internet, and it's not that I believe everything that I read there, but it helps to give me ideas of things to search that are more specific. So for example, if you want to search for, what do I do about a headache while I'm pregnant, search essential oils for headache during pregnancy and see what you come up with there. Cross-reference the things that you find and then go from there and look at the pocket reference or the desk reference to see if you find anything about not using those oils during pregnancy, how to be careful, and so on. After you do the baseline research and you have some ideas, then ask. So find a health practitioner, essential oils expert who really knows what they're doing and ask their opinion. This is the step I always like to take next because it helps reassure you that what you found in your research is okay to do and that you've got valid information. The next thing is to try it out. So you've researched, you've asked, you have a plan, you know how much you're going to dilute the oil, how you're going to use it, and then, thank you, this is Evan, you're going to do a test patch on the inside of your forearm. So dilute the oil however you're going to use it, and then put it on your forearm. If you're going to diffuse, then you don't have to do this step. Just diffuse for a few minutes and see if you have any symptoms come up. If you're going to be putting it on your skin, then you want to test the patch on the inside of your forearm. Observe what happens, see if you have any skin reactions, if you feel any differently, and then if everything's okay, go ahead and use the oil. If over time you notice any symptoms or reactions or you're not getting the results you want, then modify. Go back to step one, look at that research that you found and get some other ideas and then try out those. Ask again. So you've got research, ask, try, and modify. I'll also include a list for you of the oils that you probably want to be careful of, either stay away from during pregnancy or be extra cautious of using while you're pregnant. So those are the simple safety and usage guidelines. You can diffuse, you can put oils diluted on your skin. I don't usually recommend people taking them, taking them internally while pregnant, but it's up to you whether you're comfortable with that or not. And this is Evan. Evan's 6 months old, and when I was pregnant with him, I used oils throughout my whole pregnancy, safely and effectively.